master's degree in pharmacology. On one hand, the endocrine system is responsible for the production and regulation of chemical substances called hormones. On the other hand, psychotropic drugs can influence the metabolism and synthesis of various hormones and impact on the functioning of the endocrine system by inducing dysfunctions. Therefore, my dear psychiatry residents, I wish to engage you in a conversation about psychotropic induced endocrine dysfunctions. Before we proceed to the main topic of this presentation, it is important for us to have a common understanding of what endocrine system is. According to the National Center for Biotechnology Information, NCBI defines the endocrine system as a complex collection of hormone-producing glands that control basic body functions such as metabolism, growth, and sexual development. The primary endocrine glands that make up endocrine systems comprise of the pituitary, the pineal, the thalamus, the thyroid, and the parathyroid, pancreas, adrenal, and testes for males, and ovaries for females. As I mentioned earlier in my introductory remarks, the endocrine system is responsible for producing and regulating the chemical substances that are also known as hormones. And simply put, hormones are chemical messengers that transfer information and instructions from one set of cells to another. Now let us take a look at how psychotropic medications interact with the endocrine system. Psychotropic medications, including antidepressants, antipsychotics, and mood stabilizers, may cause adverse endocrinological effects. But one may wonder how psychotropic medications exert such effects on the endocrine system. The principal underlying factor is the way that they function. This is because psychotropic medications interfere with the central neurotransmission of dopamine, serotonin, histamine, and endocannabinoids in selective and non-selective ways, therefore implicating the endocrine system. Simply put, many psychotropic medications operate by acting on the neurotransmitter receptors or downstream signaling system, which then affects the endocrine system. However, it is imperative to note that some effects on the endocrine system may result from two other clinical dimensions other than the use of psychotropic medications. For example, primary endocrine disorders and their treatments have the potential to cause or aggravate existing psychiatric symptoms by altering the levels of the serum hormone. Also, psychiatric disorders themselves can have a role in the dysregulation of the endocrine system. For example, depression has shown to aggravate insulin resistance and to impair the glycemic control in diabetics. In this slide, we shall begin looking at the psychotropic-induced endocrine dysfunction with focus on the major effects. For the purpose of clarification, I shall present the effects, the dysfunction, the psychotropic medications implicated, and the treatment options that are available. The first dysfunction that is associated with psychotropic medication is hyperprolactinemia. Hypoprolactinemia refers to the presence of abnormally high levels of prolactin in the blood. Some of the psychotropic drugs that have been associated with causing hyperprolactinemia include paliperidone, risperidone, and antipsychotics. There are several treatment options, which include changing medication to clozapine, aripiprazole, and ziprazole. Another option is to exercise caution with the usage of dopamine receptor antagonists. There is also the option to supplement the hormone estrogen and progesterone, or supplement calcium and bisphosphonates. Although it may be rarer than hyperprolactinemia, hyponatremia is also considered a psychotropic induced endocrine dysfunction. Hyponatremia is the condition where the concentration of sodium in the blood is low. The reason why it is paired here with the syndrome of inappropriate antidiuretic hormone secretions is because SIADH is a common hyponatremia caused with matching hypoosmolality, lack of volume depletion, or other hyponatremia causes, such as no diuretics, normal adrenal, and thyroid. Some of the psychotropic drugs that have been linked to hyponatremia include oxcarbazepine, carbamazepine, desmopressin, diuretic, and methyldiazepate receptor antagonists, and non-steroidal anti-inflammatory drugs, and serotonin reuptake inhibitors, SRIs. The treatment options for hyponatremia include use of alternative treatments, restricted water intake. In the case of severe hyponatremia, slow intravenous infusions of saline is recommended. Nephrogenic diabetes insipida, NDI, is another endocrine effort that psychotropic drugs can induce. By definition, NDI is an inability to concentrate urine due to an impaired renal tubular response to vasopressin, ADH, which leads to excretion of large amounts of diluted urine. Clozapine and lithium are the main psychotropic drugs that have been associated with inducing this endocrinological effect. There are 3 treatment options for psychotropic induced NDI. These include reducing the dosage of implicated drug or drugs, consideration for alternative treatment options, and you can also consider introducing aldehyde cautiously. There are also some psychotropic-induced thyroid-related dysfunctions. The first one is hypothyroidism, which is simply a condition that is characterized by abnormally low thyroid gland activity and often culminates in growth retardation and impaired mental development in both adults and children. The psychotropic drugs that are implicated in inducing hypothyroidism include lithium, in most cases, and although rarely, some anticonvulsants, particularly phentermine, oxcarbazepine,
carbamazepine, and phenobarbital, and antidepressants and antipsychotics, especially olanzapine and klonopin, may also induce hypothyroidism. In the case of psychotropic-induced hypothyroidism, use of alternative treatments, approaches, and considerations for replacement therapy are recommended. The second one is hyperthyroidism, which is overactivity of the thyroid gland that results in an increased metabolic rate and rapid heart rate. Of the psychotropic drugs that are associated with including and inducing hypothyroidism, lithium tops the list. In rare cases, valproate and carbamazepine may be implicated as well. As for treatment of psychotropic-induced hyperthyroidism, introduction of alternative treatments that do not include the implicated drug or drugs, and consideration for cinacalcet are recommended. There are several other psychotropic-induced endocrine dysfunctions, apart from the ones that we have already taken a look at today. For clarity, I shall present the dysfunctions in a table with columns from the endocrine dysfunction, the drug implicated, as well as the treatment options that are available. The first one is sexual dysfunctions, which could range from erectile dysfunction and premature ejaculation in males to vaginal dryness in females and decreased sexual desires in both male and female. For example, SSRIs like anorgasmia, SSRIs like escitalopram, and paroxetine have been implicated in inducing sexual dysfunctions. Similarly, some atypical antipsychotics like Risperdal have also been shown to have an impact on sexual functioning. The treatment options for psychotropic-induced sexual dysfunctions mainly revolve around using alternative treatment options and avoiding some psychotropic medications altogether. Psychotropic medications have also been shown to induce weight loss. Some of the drugs implicated in those include psychostimulants such as dextroamphetamines and methylphenidates, as well as SSRIs, in particular buspirone. To treat psychotropic-induced weight loss, the use of alternative treatment options is recommended. The last psychotropic-induced endocrine dysfunction that we shall review today is obesity and metabolic syndrome. The drugs that are implicated in this fall under the following categories. Antipsychotics are the first category, with drugs such as zopamine and olanzapine topping the list here. Antidepressants are the second category. Example of drug categories are amitriptyline, mirtazapine, citalopram, sertraline, paroxetine, duloxetine, and esomeprazole. The second